Hi, everyone. My name is Dr. Julie Bindeman. I'm a reproductive psychologist and I practice in the greater Washington, D.C. metropolitan area. I am currently on the executive committee of the mental health professional group within the American Society of Reproductive Medicine. I've been a reproductive psychologist now for about 16 years, going on 17. It is an area that I feel passionately about, and it's certainly an area that we don't tend to get a whole lot of education about. I have contributed several book chapters in the topics of reproduction, all its various components, and I am about to release a book where I am the editor of that focuses on mental health professionals and learning about abortion. In graduate school, and I don't know about you, but for me in graduate school, the topic of sexuality or sex or reproduction barely came up at all. We didn't have any focused curriculum on it. We didn't have any kinds of readings that we did about it. So everything that I learned about reproduction was either from high school biology class or was from my own experience in terms of my journey to parenthood. It wasn't until I learned that, wow, there's a whole lot of intersection between psychology and all of the different kinds of reproductive challenges a person might have, where I recognized that this intersection is super important. And then I started to dig around to figure out, well, how do I get trained in this? And what I found 17 years ago was there wasn't very much in terms of training. Unfortunately, that hasn't changed a whole lot in the past 17 years. You have to kind of know where to look if you want to get really deep training. So it felt really important to me to be able to offer training, even just an overview of what reproductive psychology is, so that people can gain an interest in it and then potentially seek out that deeper knowledge. Because as I mentioned, the majority of us know nothing about it. And so we're really unequipped when patients come into our doors and sit on our couches and they're talking about these kinds of matters. And we're sitting there going, okay, I can be empathic, but we don't necessarily know what else we can offer. Whenever we get trained in something, we want to know what am I going to take home from this? What am I going to learn from this? Why will this impact my clients and how will this help me? So this training is going to be engaging. It's going to pique your interest. You're going to think about reproduction in a way that you've never thought about. For example, have you ever asked your clients about their reproductive story? Do you even know what your reproductive story is? This is a framework that you will gain from this training that can just be so useful to even start this conversation. Do you know how to talk to your clients about loss? And are you even aware of the dozens of pregnancy losses that a person can encounter and the nuances psychologically in terms of how they impact a person and a couple? That's another takeaway that you'll get from this training. I look forward to seeing you all on March 25th, 2024 from 10 a.m. to 5:15 p.m. Eastern Time for this really innovative and exciting training. So please join me so that you can have an overview on what reproductive psychology is and be able to better serve and better help your clients, whether we're talking about a current or a past reproductive journey.